for IDD Services Champion RFA. I am going to share my screen. And we'll get started in just 1 second. Thank you all for coming. I'm grateful for each and every one of you who is interested in learning about this RFA and potentially applying. Oh. All right. So I have my colleagues on the line assisting me today. I have our Executive Director, Tally Wells, our Director of Business Operations, David Ingram. Also have fellow Systems Change Manager, Pam Hunter Dempsey, and Melissa Swartz, and Philip Woodward. So we're all here for the IDD Services Champion RFA, which is an RFA under our State Plan Goal 1, which is to increase financial asset development for individuals with IDD. Here we have our agenda. So we are getting started, and we will let everybody get in. Oh, so I can keep track of the time. And we will start in about 6 minutes. We'll let folks trickle in, and then I will welcome everyone officially. And for those who are already on, if you want to start introductions in the chat, please list your name and the organization that you work for. That would be greatly appreciated. And my colleagues are monitoring the chat for me. And so here's our agenda. We'll go over the intent of this RFA, how you will submit your grant application. Then we'll have a question and answer time. And then for those who are not familiar with the council, I can go over our introduction to the North Carolina Council on Developmental Disabilities, which is a short slide, and you'll learn everything that you need to know about who we are. And then we'll adjourn. So we'll give folks a few more minutes to join, and then we'll get started. I just want to share with everybody how excited I am to get this RFA released. It was released on March 6th. And we're just excited about this opportunity in North Carolina for employment for folks with intellectual and other developmental disabilities, and family members to have an opportunity to be employed during this time. So North Carolina is moving towards its employment first legislation, and we are excited, and this is an exciting opportunity that we hope folks with IDD will have an opportunity to really get their voices heard in the services that impact them. So 3 more minutes and we'll get started. And for folks who have joined since we started just a few minutes ago, be sure to write your name and organization in our chat so that we can make sure we acknowledge you being here, so that you can receive the question and answers to any questions that are posed during this session, that you'll get those sent to your emails. Okay. I'm going to jump the gun by a minute and get started. So general information about the IDD Services Champion RFA is that our this grant will be, the applications will be due on Wednesday, April 19th, 2023 at 5 p.m. Eastern Daylight Time. So unfortunately, any late applications will be refused, and all submissions must follow the DD Suite format. So we will go through how you will apply for DD Suite towards the end of this presentation. But we need all applications to follow the DD Suite format, and late applications will be refused. So this is how our award process will work. Grant applications review committee will form and will meet in April to review all of the applications that are received. Our review committee will make recommendations to the full Council on Developmental Disabilities, and our council will make the final determination of who will receive this grant at our May 2023 council meeting. Implementation of this grant is to start on July 1st of 2023. So the intent of this RFA, our council is requesting applications for a 3-year initiative that will be $80,000 a year for up to 3 years, with the 25% non-federal match requirement of $26,667 to champion and increase employment and leadership of individuals with IDD within the systems that impact the developmental disability community. So what's important here is that we are really looking for a champion to help really carry out the motto of nothing about us without us in the IDD services, in the IDD community. We want this, the awardee for this RFA to really champion and increase employment in leadership roles for folks with IDD and family members with lived experience. So the main objectives of our RFA will be to employ self-advocates and family members. So we're looking for a provider who will be committed to, over the course of this 3-year initiative, to help individuals with IDD and family members become employed in leadership roles across the state. We're looking at approximately 25 self-advocates and family members with lived experiences being contracted in the 2nd year. And at the end of this initiative, we're hoping for between 75 and 100 new self-advocates and family members with lived experiences being employed in leadership roles. Another objective is to inform individuals with IDD and family members with knowledge and tools to transform their lives and trajectories, and to increase employment, to raise awareness of competitive integrated employment, post-secondary education, transition planning, assistive technology, and options for state-funded services. Okay. Another objective that's going to be important for this RFA is to establish relationships. We want to see this contractor establish relationships to share knowledge of community resources, referrals, and really participate in a collaborative process to expand services and supports for families with youth and who have developmental disabilities. We're focused on leadership for family and peers. So this initiative will focus on developing a network of family and peers to help support others navigating through the IDD service system, including employment. Another objective is that we will have an ongoing forum or network. This is really to bring folks together to help move towards these leadership roles and help others navigate through the IDD service system, and develop capacity for self-advocates and family members to obtain paid leadership roles. I can't say it enough that this initiative's the heart of this initiative is to get self-advocates and family members in paid roles, because we know that their expertise is going to help propel this system, help everyone to navigate this system better, and they deserve to be paid for those leadership roles. So we want to see more self-advocates and family members in these paid leadership roles in the IDD service system. So the deliverables. The first step in this initiative is that we hope that this initiative will take the first 3 months to develop a robust plan with concrete action steps for increasing employment and leadership for individuals with IDD and their family members. It's going to be important that each application really detail how that plan will be carried out and how you will meet those objectives of having, by the end of the 3 years, up to, or maybe even more than 100 people with IDD and or family members employed in the IDD service system. It's important to note that it's important to our council that this initiative really focus on getting folks employed in leadership roles who have an intellectual and or other developmental disability. Family members play an important role, but the full intent of this initiative is that at least more than half of the folks who become employed in these various roles are individuals with IDD. Number two, you will actively recruit and establish a network of self-advocates. This network will be helping folks, self-advocates and family members, obtain these paid leadership roles in the system. Some of the paid leadership roles that we are aware of at this point are care extenders, family navigators, and peer mentors. Remember, you are not limited to these paid leadership roles, but these are just some examples that you can think of how you can work towards getting folks with IDD employed in leadership roles in the service system. It's going to be important that you engage with the North Carolina Division of Mental Health, Developmental Disabilities, and Substance Use Services. It's going to be important that you engage with those who will hire care extenders, the LME MCOs, all of the different agencies and groups where there are going to be opportunities for individuals with developmental disabilities and family members with lived experiences to take these leadership roles. You'll develop recommendations for the types of trainings, competencies, flexibilities, and core policies and processes that are going to help sustain this system, help not only the folks who are impacted in this first 3 years, but continue to provide leadership around and guidance around how we can best support self-advocates in the IDD service system in leadership roles. Part of this initiative will be to identify barriers and advocate for policy change around hiring practices. We know that there are barriers that have historically prevented folks from IDD and their family members from getting these paid positions. So part of this champion role will be to identify those barriers and advocate for policy change to make things, try to eliminate or reduce the barriers that keep self-advocates from these roles. You're going to champion employment and leadership among family members and self-advocates to be employed in these important roles. And again, here are a list of different areas where folks with an IDD and family members could be included in leadership roles, like care coordination, schools, and advocacy at our local management entities / managed care organizations for the state and provider agencies. You're going to spread awareness of competitive integrated employment, inclusive post-secondary education, employment first in North Carolina, home and community-based services, supported employment through 1915I, employment of family members and peers in care coordination and assistive technology. You will expand self-advocates and families' abilities to build capacity within this support system. You'll develop and implement satisfaction surveys and data collection, addressing how prepared individuals with IDD and family members are to find, apply, obtain, and retain these leadership roles in the IDD service system. It's going to be very important that this contractor really focus on how are we measuring success as we move forward through this initiative. We definitely want to keep track of the numbers of folks who are hired, the types of positions that they receive, and how they will be able to maintain those jobs moving forward, even after this initiative is ended. And devise methods of tracking for how many self-advocates and family members with lived experience are hired and where they're hired. So it's going to be very important that this contractor really focus on the data collection, because that's how we can measure the true progress that we're making in getting folks with lived experiences in these paid leadership roles. So now that you have the full intent of this RFA, I'll talk to you about how you will apply. So the first suggestion is to become familiar with DD Suite. If there are those of you who have already clicked on the link to apply, just to start getting familiar with DD Suite, I applaud you. But the full application process will go live after our bidders workshop today. So for those who have already checked, check back again, and you will be able to see the full application and see exactly what I'm going through for the rest of this presentation. So an important note is that complete and save your work in Word format, and then cut and paste it into DD Suite. This is important because for many reasons, there may be system glitches we call them internet gremlins around here, that may prevent your work from being saved in DD Suite. There is an auto save function in DD Suite, but just to be sure, just to cover your activities, make sure you type out your narratives in a Word format and then cut and paste those into DD Suite, so that you can have a record of what you've pasted and of what you've documented. And you don't have to keep repeating that if there are any issues with getting that information in DD Suite. You want to save frequently to make sure that your application and all your hard work is there, and get an early start. So I appreciate those who have already attempted to start an application, but wait until after this Q&A session, and then it'll go live and you'll be able to start thinking through your application. So this is what you will see for our DD Suite application. You must create an account. Multiple users for a single grant application are allowed. And you will go in, create your application. There are documents on our website for all of how these steps are lined out so that you can find and easily access those. If you do have questions, feel free to email or call, and we can get those answers to you if you're having technical issues with getting into DD Suite. And once you click into DD Suite, into the notice of funds available, you will see a page that looks similar to this. This is an example so that everyone can see what it will look like. It of course will have the IDD Services Champion RFA number and name here, and it'll give you all the specifications, and will give you all of the information about goal 1 in our state plan for our council. And so you'll know you're in the right place when you are clicking on the funds, the notice of funds available for the IDD Services Champion RFA. But this is how it'll look. Each role in on your team that you will develop as you make this application will complete this personnel section. And this is how it'll look. You'll click on your organizational role. There'll be a drop-down list so that you can list the different organizational roles and select the person and complete this information in DD Suite. The initiative outline form is comprised of 7 sections, multiple part questions, and they each have a varying character limit. This will produce the scope of work for the initiative once you are awarded that initiative. So your application will tell us how you will carry out the objectives and deliverables that are outlined in the RFA. And then once that contractor has been selected, we will use the elements from your application to develop a scope of work, and that will lead and guide us through the 3-year process. Here are the outline questions. So there are 7 sections, and I'll go through each one of these sections in just a minute. But when you click on this page, you'll see the name and title, IDD Services Champion RFA. And you will have these outline questions. And I'll go through each one of these in detail in just a minute, but you'll see the character limits here and what you are supposed to complete in that section. So for the executive summary, there's a 2,500 character limit. This will be the framework for your proposed initiative. You'll provide a descriptive summary, evidence-based and best or promising practices or policy that are already established. You will, in 2,500 characters, describe the applicant's agency. So you'll provide descriptions of qualifications and experience that make you the best candidate to be awarded this grant. You provide the organizational structure for your initiative. So you'll tell us how your organization is set up and who will be the key players as we move forward in carrying out this initiative. Current and past collaborative efforts related to the proposed initiative and collaborative efforts including people with IDD and family members. So you'll just give us in 2,500 characters or less, a description of your agency. And here I will also note that if you do run out of characters in any section, you can add an unlimited amount of additional documentation. So if you complete the 2,500 characters and still have more that you want to say to describe your agency, know that you can import those on a Word document that will complete that section for it. So even though DD Suite is limited to 2,500 characters for this section, you can provide additional information if you need to. So you'll give detailed narratives, and those narratives will be 4,000 characters, and you'll describe the need for the initiative. You'll describe any relative data and data gaps and trends that you have identified. You'll describe the target population, and it must target people with intellectual and other developmental disabilities and family members. You'll talk about your accomplishments. There'll be 3,000 characters for this section, where you will indicate outcome measures that will be used to determine extent initiative, if the extent the initiative is meeting the goals and objectives. So we want you to define those outcome measures. So data collection is going to be important. How are you going to meet the goals and objectives for this initiative? The methodology, another 3,000 characters. So you'll talk about your initiative personnel, which could include subcontractors, their roles and responsibilities. You will describe proposed resources. And you'll describe the type, the amount, and distribution of any additional resources. And you can talk about partners. You describe a plan for partnering with stakeholders. Sustainability of the plan. So what's important to our council is that we manage the funds that are given to us well, and that once an initiative is funded, at the end of those 3 years, the initiative just doesn't end. That we want to see a comprehensive plan of how your organization will continue this work beyond the funding that we are providing for the duration of this initiative. So it needs to be comprehensive and appropriate. It'll describe how applicant will sustain and promote the work of the initiative, which will include organizing, attending, and presenting at local, regional, and statewide conferences, webinars, and other trainings. It can include replication if applicable, and any creations of guidebooks, brochures, or the use of social media. How will you, as an organization, carry out the intent of this RFA beyond 3 years? Monitoring activities. So you'll need to provide a detailed description of how you will be monitored and evaluate performance activities and outcomes. You'll describe how and when applicants will assess and use proposed evaluation tools, and include a timeline that has target dates and who's responsible from your agencies. Your timeline must reflect 3 years. So you'll describe goals, objectives, activities, and outcomes for that will reflect over the 3 years. One thing that to note here is that you want to make sure that your budget will reflect just the first year of this initiative. So we want to have a timeline that will, if or how you have proposed that you will carry out those goals and objectives over 3 years, not 4, as listed here, 3 years. And you want to make sure that everything is clear so that our review committee will be able to understand where you're going. And what's already outlined in the deliverables is that this first year will be the robust planning year for this initiative. So you will, over the 3 years, you will reflect your objective and list each objective separately, activities that will be included in how you will carry out this initiative, a timeline, projected start and completion dates of each activity that will be covered over 3 years, not 4. The people who are going to be responsible from your agency, and the performance measures, where you identify corresponding performance measures for each objective and activity that you list in your work plan. So here is what you will see in DD Suite related to your project work plan. You'll add each objective that you identify at this point. Once you click in, you can click on the performance measure that's going to be most appropriate for the activities that you have outlined in your plan for how you're going to complete and carry out this initiative. There's a drop-down menu, so every time you see a caret symbol, you can drop down and then you'll see the list of performance measures, and you click on the one that is most appropriate. Here, it's important to note that there's going to be a budget narrative that's required. Here, you want to outline and detail all of the ways that this money that we will give you will be spent. You can, the tasks are listed here as staff salaries, fringe benefits, supplies and materials, equipment, travel, all of the things that are here. You want to make sure you fill in those each selection so that we can know how you will budget the money for this initiative. So, like I said, the budget categories will provide a detailed budget information for each line item, including indirect costs and the total program costs. And the total program cost will be the sum of the match that is required and the DD funds for this initiative. So your match for this initiative can be either cash or in kind, and you need to specify how you will meet those match requirements in your budget narrative. So in kind, some examples are the cost of office space or staff time contributed by your organization, but there are 2 types of matching that can be done, either cash or in kind. So there are some documents that are required for an application to be approved by our council. You have to register, each applicant must register with the North Carolina Secretary of State. And so it's important that you go to our website and look at those documents that are required, because each one of those needs to be a part of your application. There you'll find information on our website. You'll find information about the assurances, conflict of interest forms. Not-for-profit organizations have information that they need to complete, like the 501c3 documentation, and refer to our website for a complete list of handouts. And those are posted now on the RFA webpage. Endorsements or commitments. This section is not required, but it is encouraged that you include letters of endorsement and support that indicate coordination and collaboration from agencies and organizations at the state and community level, how they are described as initiative partners. So remember that these endorsements and commitments are not required, but we do encourage this. It helps to strengthen your application so that we know who are going to be the folks who endorse your work and who are supporting and collaborating with you to get this initiative completed. So we're coming to the end of my presentation. Grant applications must be submitted through DD Suite by 5 p.m. Wednesday, April 19th, 2023. Late applications will be refused. All submissions must follow our DD Suite format. Our review committee will meet not between September and October. They will meet in April. And the grant application review committee will make recommendations to the North Carolina Council on Developmental Disabilities. The full council will determine who will receive this grant in May 2023 council meeting. Implementation of the grant will begin July 1st, 2023. Here's our contact information. So if you are unable to complete your application in DD Suite, you can mail a hard copy to us at our mailing address here. But it must, remember, it must follow the DD Suite format. So it has to include all of the parts that are mandatory for your application to be reviewed. If you have questions about this RFA or the process or any questions, feel free to email us at rfainfo@nccdd.org. We have our web page here listed, and I can give you our phone number, which got cut off on this slide. You can reach me if you have questions at 984-920-8208. I believe if there's other contact information, you can get that too. Thanks to everyone for participating today and for responding to our requests for applications. I will stop share right there. And David, are there, I know that there are important steps that we need to take or our applicants need to know about making sure that they have all of their identification numbers. Do you want to give a brief?
Yeah, so sam.gov issues unique identification numbers. Used to be Duns and Bradstreet, I think. And because we receive and access federal funds, it is required for any subrecipient of those funds to have SAM UEI, unique entity identification. And so I don't know, Pam, if you have that website able to bring up to share. We also require for you to contract with us because we're part of the state. The requirement is to be registered with the Secretary of State before we can make any payment or sign any contract. So those are two important steps that you don't technically need to engage in until after the award, but it will substantially increase the amount of time. On occasion, it substantially increases the amount of time it takes to have that contract go through and finalize. So we strongly recommend that applicants, for the sake of solvency and all of that wonderful stuff when you're accessing funds, to go ahead and take these steps. And you don't have to fully register with sam.gov. You just have to access it and fill out enough paperwork to get the unique entity ID, and the instructions are on our website here. Thank you, Melissa. It's a wonderful YouTube video. This is David, go ahead.
Oh, we are a little ahead of schedule. So now we can move into the question and answer portion of our bidders workshop. So if there are questions, you can feel free to come off come off mute and or include your questions in the chat.
Samira, this is Pam. We have a question in the chat from Emily. That question reads, do you have to be a nonprofit to apply? Thank you for that.
You do not have to be a nonprofit to apply. If your organization is a nonprofit, then there are forms that need to be completed, but you do not have to be a nonprofit to apply. Second question, will only one grant be awarded? That is correct. There will be one awardee for the IDD Services Champion RFA. One will be selected among the many qualified applicants who will apply from today.
Hi, it's Beth.
Hey,
Hey, good to see you. Question is, well, two questions. First of all, for those of us who are a little bit late about getting additional questions, are we still allowed to ask questions of you afterwards?
Absolutely.
And do they go to you directly, or do we go to the RFA?
RFA info at nccdd.org, and you can get you submit your questions there. We will add all questions that are asked to our to the web page, so that everyone can be aware of all of those questions and get those answers to those questions.
Thank you for that. The second part is there any precedence for with the DD Council where you could use this grant to help satisfy some of the goals and objectives for another grant that you have?
That's a good question. I'm glad our Director of Operations is on
Yeah,
this.
this is David. I think the safest answer, and we'll certainly look into for any and all questions, we're documenting those, and we're going back as a team to look at the answers we've provided and see if we need to add any information, and we'll send that out to all individuals who are registered for this event, and on our website it'll be listed there too. For the scope of work of this contract, for the successful vendor or applicant, it'll be expected that they meet the demands of this grant, and for the federal funds that are allocated toward that, that's the expectation for the reporting, and the same for any other grant, that those efforts will be funded through the grant for that scope of work.
That makes sense. Thank you, David. Appreciate it.
We have another question in the chat that reads, it's from Lori, that reads, do you need to support individuals across the state, or can it just be regional? The intent for this RFA is that it reach across the state. So efforts should be made to make this a statewide initiative. This is where documentation of the data and data collection is going to be important. If there are just particular regions that were covered, I believe that that's okay. It's just that we want to make sure that this opportunity is spread across the whole state.
Hey, Tamara.
Hey, Laura.
So I had a question about the number of folks that you're hoping to be employed by the end of the 3-year contract. Does that mean that you're hoping that, like, when the 3rd year is done, 75 to 100 people will remain employed, or do you mean throughout the 3-year project, you're hoping that 75 to 100 people will have had a chance, will have been a part of the employment process?
That is a good question. The intent of this RFA is that at the end of the 3 years, there will have been an increase in employment in these leadership roles. We are focusing heavily on the data and we want the numbers. So, but if someone got a job, was in one of these roles, and then let's say year 3, they lost that job for some reason, I think that person would still, or those numbers would still be counted in the 75 to 100. We want the employment numbers to increase, but there's no way we can factor in, if someone loses a job. So if any of my colleagues want to weigh in on that question, but I believe that, the intent is just that folks will get these jobs. It is important that they maintain them, and that the organization will help support individuals in maintaining these leadership roles. But I would say that the goal is between 75 and 100 at the end of the project.
And if there are people who are hired as subcontractors to help with the, if there are curriculums developed or something like that, and they are hired as subcontractors with the grant funds, would that count? So that wouldn't necessarily be, a long-term position for them, but a part-time, time-limited position. Is that something that would be considered? Are you looking for sustainability-wise, you would like to see people in long-term fixed positions?
State your question one more time, Laurel.
I don't know if I can. So
It's a good question. It's a good question, Laurel.
Thank you, Beth. So I'm wondering if we were to develop a plan where we used some of these funds to have sort of development partners or research partners with us. So some folks that may be self-advocates, or that may be family members of individuals with IDD. If we were to hire them with some of these grant funds to help us develop a curriculum, that to me feels like a leadership role, but it would be a time-limited leadership role. So they would have some employment, but probably just during the development, unless there was some way that then they could also be a part of the implementation. So if they were hired for that as like contract workers, is that something that would be acceptable to count in those numbers? Or are you really wanting to count in those numbers sustainable long-term fixed jobs?
That's a good question. And we will provide the final answer to your question at in our question and answer document that we will upload to our website.
Perfect.
But thank you for posing that question now for us to discuss. Melissa, did you want to chime in?
I had 1 and 2, but your answer is so much better than mine. Let's hold off on responding to the actual question until we have a chance to deliberate as a team.
We had another question in the chat from Victoria. Is there any representative from VR involved with this project, or a formal way for the project lead to connect with VR to support project activities? This also is a good question as we discuss this now. The intent of this RFA is that there be collaboration with our state agencies that include vocational rehabilitation. Council staff can help guide those connections with VR. So it is an expectation that VR be involved and also be one of those positions, find leadership positions in vocational rehabilitation for folks with IDD. The next question that I see in the chat is from Beth. How do you define employed? Is part-time or hourly considered employed? So when we define employed, we're talking about competitive integrated employment. Part-time is considered employment as long as it is competitive and integrated. And any further discussions and decisions that we make regarding this question will be added to our Q&A section on our webpage. So we will have further discussion as a council regarding your questions, each one of the questions that are posed here, and you'll find the formal and final answer on our website after our informational session.
I think that's important because a lot of who you're trying to employ, the advocate or the self-advocate, they would have time limitations for job work anyway. So thank you very much.
Sure. Are there other questions? I think I addressed all the questions in the chat. If your question was not addressed, please feel free to come off mute and we will answer your question, and formal and final answers will be in a document that we will create from all of the questions and answers that come from this session and that come over email. Will be posted to our website so that everyone can have access to that information. So it's not too late to ask your questions.
Would you repeat the deadline for submission of questions so they can be posted? Thank you, Tamara.
Okay. Questions? David, can you just verify, is that a week after our bidders workshop that those question and answers will be posted?
I'm gonna double check our website just to make sure we
Okay.
we typically do it within 1 week, but I want to make sure that we're consistent.
Okay.
Messaging.
All right. So we will get the answer to that question, and there's one to make sure that we verify those the time for submission for those questions and answers. And we have one more question in the chat. What does leadership role mean to the North Carolina Council on Developmental Disabilities? Beyond care extender type positions, are there any other positions that have been made accessible in state offices for adults with IDD? Leadership for the council means that these individuals are employed in roles that impact the services that support them. There are other roles beyond care extenders that do include care extenders that are available. So we are really looking for an agency that will be able to identify some of those additional roles. There are roles in care management agencies. There are roles in our state CFACs and local CFACs. There are opportunities in education, in policy. Some examples are listed in the RFA, but there are roles beyond care extenders where folks can find leadership roles that will help them identify and help guide the service system, the IDD service system. Thank you for your question, Victoria. And this question, like all the questions, will be answered in their final and complete form on our website.
And this is David, Tamara. I don't see it listed on our website,
Okay.
but we will absolutely work to get the responses to the Q&A as quickly as possible and no later than by next Tuesday, end of business.
So you can check our website by the end of business on next Tuesday for the complete answers to all of the questions that were posed here and over email.
And then as they come in, we'll do our best to answer them. What we will absolutely not want to do is answer them individually. We will work to send the answers to all potential applicants. So people who've shared interest in receiving this information, and we'll post it to our website as well, and an alert that we've updated it.
If you have questions, I'm going to move on to our introduction to the North Carolina Council on Developmental Disabilities. But if you have questions that you think of as I move forward, feel free to add those to the chat. And there are staff from the council who will be monitoring the chat, and we will get to those additional questions as well. So I will pull up my slides so that you can get an introduction to the North Carolina Council on Developmental Disabilities. I'm going to share my screen. I want to thank you all again for coming to this bidders workshop for the IDD Services Champion. And now I'll go through our presentation on who the North Carolina Council on Developmental Disabilities is. We are a part of a national network of 56 organizations that assist people with intellectual and other developmental disabilities and their families. We're funded by the U.S. Office of Intellectual and Developmental Disabilities. There is a council on developmental disabilities in each of our country's state and territories. And so North Carolina is the council for North Carolina, of course. The U.S. Congress created councils on developmental disabilities, and we follow the Developmental Disabilities Bill of Rights Acts and Assistance Act, the DD Act PL 106-402. The mission in the DD Act is to ensure that people with IDD and their families participate in the design of and have access to individualized services and supports that promote self-determination, productivity, integration, and inclusion in all aspects of community life. The areas of emphasis in the DD Act include formal and informal community supports, health, recreation, education, and of course, employment. And all of those areas are listed here. You have access to this slide already on our webpage for the IDD Services Champion RFA, and you will have access to the presentation for the actual RFA shortly after this session. So funding and accountability. The Administration on Intellectual and Developmental Disabilities is the federal government organization that oversees the implementation of the DD Act. And there are designated state agencies that include the Office of the Secretary, the North Carolina Department of Health and Human Services, which is our organizational home. The council makes decisions independently of the Department of Health and Human Services, and the council supervises its executive director. DHHS has an important but limited role here at the council, and that is to ensure the NCCDD staff are hired and managed consistent with state laws and receive, account for, and disperse council funds. Here is an organizational chart of how we fit into under the Department of Health and Human Services. There are agencies that fall under each one of these categories. They're all listed here. And you can see that we fall up under the Office of Intellectual and Developmental Disabilities. Under the Office of Intellectual and Developmental Disabilities, we have DDAC network partners. So we work closely with our university centers for excellence in developmental disabilities. Ours for North Carolina is the Carolina Institute on Developmental Disabilities. We also work closely with our protection and advocacy partners, which are Disability Rights North Carolina. Here we have the organizational chart for our council, and you can see that our governor is over the North Carolina councils, and he selects the members to join our council. And our current chair is Brian Dooley. We're also overseen by North Carolina Department of Health and Human Services Secretary Cody Kinsley, the Deputy Secretary, Susan Gale Perry, and the Assistant Secretary for Employment and Inclusion, Chris Egan. And they supervise our Executive Director, Tally Wells, who you met at the beginning of this presentation. Under Tally is the Director of Operations, David Ingram, who is on this call. And here you can see all of our business and administrative staff, our systems change managers who are a part of this call as well, and our public policy coordinator, Chris Hendricks. Here is a further breakdown of our organizational chart here at the council with our chair, Brian Dooley, at the top. And our executive committee, we have our executive director and staff. Our secretary is Donna Spears McGilton, vice chairs Nessie Seiler and Ryan Rotundo. And each one of our goal areas, there are 3 goal areas here, and each goal area has a base committee here at our council. Goal 1 is financial asset development, which is chaired by Tony Hall. Goal 2 is community living, chaired by Dr. Mapson. And our 3rd goal area is advocacy development. And each one of our base committees has council members that make up that committee. Council members are appointed by our governor with input from our council. They represent geographic and racial ethnic diversity of our state. And not less than 60% of people with IDD and parents and guardians of children with IDD make up our council. So we have a 40-member council, and of those, 60% are people with IDD or parents or guardians of a child or an adult with an IDD. The North Carolina Council is made up of many experts, people with IDD, and we refer to them as self-advocates, families, representatives from our LME MCOs, providers, advocates, policymakers, from 3 departments and the University of North Carolina and our legislators. We carry out the provisions of the DD Act. We gain support for the council and its positions from people with IDD, their family members, policymakers, other stakeholder organizations, and the general public. We make sure that the council is a member-driven, effective, efficient, and accountable organization. We have our 5-year state plan, and our 40 members decide how our $2 million in federal funds will be used. How we use those funds are through, with member approval, release of RFAs, like the one that you're all here for today. These funds go to initiatives across North Carolina that advance the council's goal and objectives for our 5-year plan, conduct advocacy and policy activities. Those monies are used to fund staff to manage initiatives and council funds, and to collaborate with our North Carolina AIDD network partners like Disability Rights and Carolina Institute on Developmental Disabilities. Funding and resource distribution can be in any number of these categories that can include outreach, informing policymakers, coordination with related councils, committees and programs, interagency collaboration. All of these areas are important in how we spend the money that is allocated to our council. Here is our physical address. We are located at 3109 Poplarwood Court, Suite 105 in Raleigh, North Carolina. And our mailing address is listed here. Our phone numbers are listed here. If you have questions, comments, or concerns, I know in the chat it was listed on where you can send specific questions about this RFA. But if you have any questions, there is no wrong door. Feel free to email us, give us a call, or stop by if you have questions. Okay. Thank you all for staying and to the end of our bidders workshop. We are, this ends my presentation. If there are questions, comments, concerns, feel free to add them to the chat, or send us an email or give us a call. Thank you so much for coming and participating. Have a great day. And we can stop recording, I think.